I want to tell you about a colleague of mine. His name is Dr. James Whitfield. He is a vascular surgeon with 28 years of experience operating on blood vessels in the legs and feet of older adults. And a few months ago, we were sitting together after a medical conference, just the two of us over coffee. And I asked him something that I had been wanting to ask for a long time. I said, James, after everything you have seen, after 28 years in that operating room, after thousands of procedures on legs that have suffered from poor circulation, what is the one thing you wish every person over 60 had been doing before they ended up in your care? He put his coffee down and he looked at me, and without hesitation, he said, ankle pumps. And I said, tell me more. And he did. And what he told me is what I want to share with you today. I am Dr. Daniel Chen, and today I want to explain what Dr. Whitfield told me about the single most underused, most accessible, and most evidence-backed exercise for leg circulation after 60. What it does inside the blood vessels and the muscles of the lower leg. Why it is so particularly important after 60, and how to do it correctly for maximum benefit. But first, let me tell you about the patient that Dr. Whitfield described to me that afternoon. He told me about a man, he called him George. George was 69 years old when he first came to Dr. Whitfield's clinic, referred by his GP with complaints of heavy, aching legs, swollen ankles by the end of the day, a dull cramping feeling in his calves when he walked for more than about 10 minutes, and cold feet that had been getting worse for about 2 years. George's ankle brachial index was 0.72, below the normal threshold of 0.9, indicating reduced arterial blood flow to the lower legs. His venous duplex ultrasound showed sluggish venous return from the lower legs, with mild venous insufficiency in the superficial veins. And his lower legs, when Dr. Whitfield examined them, had the slightly discolored, brownish appearance around the ankles that doctors call hemosiderin staining, a sign of chronic venous pooling and leakage of red blood cells into the surrounding tissue. George was not at the point of requiring surgery, not yet, but he was heading in a direction that Dr. Whitfield had seen led to serious consequences many times before: venous leg ulcers, deep vein thrombosis, peripheral arterial disease progression, and in the worst cases, critical limb ischemia that threatens the viability of the limb itself. Dr. Whitfield sat with George for 45 minutes, which he told me is longer than most vascular consultations allow. And he taught him one exercise. And he told him, George, if you do this every single day without fail for the next 3 months and come back and see me, I believe your legs are going to feel significantly better. George looked at him skeptically because Dr. Whitfield had not prescribed a medication, had not ordered further tests, had not mentioned a procedure. He had described an exercise that George could do sitting in his own chair at home for free. And George was skeptical because he had come expecting something more medical than that. But he trusted Dr. Whitfield, and he did the exercise every single day for 3 months. And when he came back, his ankle brachial index had improved from 0.72 to 0.81. His ankle swelling was significantly reduced. The heaviness in his legs that had been his constant companion for 2 years was noticeably better. He was walking further before the cramping started, from about 10 minutes to over 25 minutes. And when Dr. Whitfield examined his ankles, the hemosiderin staining had lightened noticeably, an objective sign of improved venous circulation in the lower legs. Dr. Whitfield told me. George looked at me and said, that little exercise changed my legs, and I want to tell you what that exercise was and why it works, with the depth of explanation that George deserved to receive before he started doing it, so that you understand not just what to do, but why your legs need you to do it. Let us start with what is happening to the circulation in the lower legs after 60, because understanding this is what makes the exercise make sense. Your circulatory system has two components that are relevant here: the arterial system, which carries oxygenated blood from the heart down to the legs and feet, and the venous system, which carries deoxygenated blood back from the legs and feet up to the heart. Now pumping blood downward to the legs is assisted by gravity. The heart pumps, and gravity helps the blood travel downward to the lower extremities. But returning blood from the lower legs back up to the heart is a different challenge entirely, because it requires moving blood upward against gravity over a significant distance, and the heart alone cannot generate enough pressure to achieve this without assistance. Nature provided that assistance in the form of the calf muscle pump, sometimes called the peripheral heart. The calf muscles, when they contract during walking, squeeze the deep veins that run through them, like a hand squeezing a tube. This squeezing compresses the veins and propels the blood within them upward toward the heart. And venous valves, small one-way valves inside the veins, ensure that the blood moves only in one direction, upward, rather than falling back down. When the calf muscles relax between steps, this system, the calf muscle pump, working in coordination with the venous valves, is responsible for approximately 40% of the venous return from the lower limbs to the heart. During walking, it is not an accessory mechanism. It is essential. Now, here is what changes after 60 and what creates the problem that brought George to Dr. Whitfield's clinic. After 60, several changes occur that impair this system. First, the calf muscles weaken. As part of the general muscle loss, sarcopenia, that I discussed in my video on what destroys muscles after 70. Weaker calf muscles generate less compression force on the deep veins during contraction, and therefore pump less blood upward per step. Second, the venous valves themselves can become damaged or incompetent over decades of use, and the elevated venous pressures associated with poor circulation, particularly in people who stand or sit for long periods, stretches the vein walls over time, preventing the valves from closing fully, allowing blood to fall backward between contractions rather than continuing upward. This is venous insufficiency, and it is the direct cause of the pooling, the swelling, the heaviness, the aching, and the skin changes that George experienced. Third, the arterial changes of atherosclerosis and arterial stiffening that accumulate after 60 reduce the arterial inflow to the lower legs, delivering less oxygenated blood to the calf muscles and the tissues of the lower leg, making them function less well and making the calf muscle pump less effective. Fourth, most adults over 60 spend significantly more time sitting than their bodies were designed for. Long periods of sitting with the legs dependent, feet on the floor, allow blood to pool in the veins of the lower leg without the calf muscle pump being activated. To move it upward, the pooled blood increases venous pressure in the lower legs, further damaging the valves and walls of the veins over time. Now let me tell you what ankle pumps are and why Dr. Whitfield calls them the most underused exercise in vascular medicine. Ankle pumps is the term for a simple repetitive movement of the ankle that activates the calf muscle pump without requiring standing or walking, without requiring any equipment, without requiring any particular level of fitness or mobility, and without placing any significant cardiovascular demand on the heart. Here is exactly how to do them. Sit comfortably in a chair with your feet flat on the floor or slightly elevated on a footstool. Now simply point your toes downward toward the floor as far as comfortably possible. Hold for 2 seconds. Then flex your feet upward, pulling your toes toward your shins as far as comfortably possible. Hold for 2 seconds. Then return to flat. That is 1 repetition, 1 ankle pump. Do this slowly and deliberately. 10 repetitions
counts as 1 set. Now let me explain precisely what is happening inside your lower legs. During that movement, when you flex your foot upward, pulling your toes toward your shin, your calf muscles contract powerfully, and that contraction squeezes the deep veins running through the calf, propelling the blood within them upward toward the heart. The venous valves snap shut behind the moving blood, preventing it from falling back, and a column of blood moves upward, 1 ankle pump at a time. When you point your toes downward, your calf muscles relax, the veins refill from the venous blood pooled in the lower leg, and the cycle repeats. With each pump, you are manually activating the calf muscle pump that walking would normally activate, but without the cardiovascular demand of walking, without the joint stress of standing, and without the requirement for a specific location or specific footwear or specific weather conditions.
You can do ankle pumps in your armchair, watching television, in your car, at a long traffic light, on an airplane, or a long train journey, in your office chair, at your desk, in bed, first thing in the morning, before you even get up. The exercise is so accessible, so low barrier, and so completely without risk for virtually all adults over 60 that there is almost no reason not to do it. And the evidence for its effectiveness is substantial. Research published in the Journal of Vascular Surgery has shown that calf muscle pump exercises, including ankle pumps, significantly improve venous blood flow velocity in the deep veins of the lower leg. Studies in patients with venous insufficiency have demonstrated meaningful reductions in ankle swelling and venous pooling with regular ankle pump exercise. Research in surgical and hospitalized patients has shown that ankle pumps reduce the risk of deep vein thrombosis
by maintaining venous blood flow
during periods of immobility and in patients with peripheral arterial disease. Like George, regular lower limb exercise programs, including low-intensity calf activation exercises, have been shown in multiple clinical trials to improve walking distance before claudication pain begins. In some studies, by more than 100% over 6 to 12 weeks. Now let me tell you how Dr. Whitfield told George to structure his ankle pumps for a maximum benefit. He told George to do 3 specific sessions per day of ankle pumps, each session consisting of 3 sets of 20 repetitions with a 1-minute rest between sets. The first session, first thing in the morning, before getting out of bed or within the first 30 minutes of waking. Because overnight, blood has been pooling in the lower legs due to the lower limb position and the absence of calf muscle activity during sleep. And morning ankle pumps start moving that pooled blood before gravity has had all day to worsen the situation. The second session, in the middle of the day, particularly if the person has been sitting for 2 hours or more without significant walking, because prolonged sitting allows venous pooling to redevelop. And a midday session interrupts that pooling before it accumulates to the level where symptoms develop. The third session, in the evening, before bed, to move the blood that has pooled during the afternoon and evening, reducing the overnight starting point of venous congestion in the lower legs. Dr. Whitfield also told George that the position of the legs during the sessions matters. If possible, performing ankle pumps with the legs slightly elevated rather than completely dependent adds gravity assistance to the venous return, augmenting the effect of the calf muscle contractions. A simple footstool or a pillow under the calves while sitting provides enough elevation to make a meaningful difference to the rate of venous return during the exercise. Now, I also want to share something else that Dr. Whitfield mentioned during our conversation that I think is important. He said, Daniel, the tragedy is not that this exercise does not work. It does work. The tragedy is that by the time most patients reach my clinic, they have had poor leg circulation for 5 to 10 years before anyone did anything about it. And by then, the valve damage is done, the skin changes are established, the arterial disease has progressed, and what might have been prevented or significantly delayed with something as simple as ankle pumps done consistently from age 60 is now a condition that requires medical management for the rest of their lives. He paused, and then he said, the most powerful intervention I have in vascular medicine is not in my operating room.
It is in what I tell people before they get there. And I think about that every time I see a patient whose legs could have been different if someone had told them earlier. Now, let me also tell you about 4 other habits that work alongside ankle pumps to protect leg circulation after 60. The first is avoiding prolonged sitting without movement. The research on sedentary time and venous health is clear. Every 45 to 60 minutes of continuous sitting should be interrupted by at least 5 minutes of standing, walking, or ankle pumps. If standing and walking are not possible, this interruption of sedentary time is one of the most important and most accessible lifestyle modifications for venous health in older adults. The second is compression stockings. For adults with diagnosed venous insufficiency or significant venous pooling, properly fitted graduated compression stockings applied in the morning before getting out of bed, before gravity has had a chance to fill the leg veins, provide ongoing mechanical support to the venous walls and valves. Throughout the day, they are not comfortable for everyone. And fitting matters, but for those with significant venous disease, they are one of the most evidence-backed interventions available. The third is leg elevation during periods of rest. Whenever possible, when you are resting in a chair or lying down, elevating the legs above the level of the heart. If possible, uses gravity to assist venous return without any muscle effort. Even modest elevation of the legs on a footstool is better than keeping them dependent during long rest periods. The fourth is staying hydrated. Dehydration, as I've discussed in many previous videos, increases blood viscosity, makes blood thicker and more sluggish in its movement through the venous system. Adequate daily hydration of 6 to 8 glasses of water distributed throughout the day supports normal blood viscosity and therefore normal venous flow through the lower extremity with every pump of the calf. Let me bring everything together. Poor leg circulation after 60 is driven by multiple factors: weakened calf muscles that generate less pumping force, damaged venous valves that allow blood to pool, arterial changes that reduce inflow to the lower limb, and prolonged sedentary time that removes the stimulus for the calf muscle pump to activate. Ankle pumps, 3 sessions per day, 3 sets of 20 repetitions per session, performed with legs slightly elevated if possible, directly activate the calf muscle pump. Move pooled venous blood back toward the heart, and over weeks to months of consistent daily practice produce measurable improvements in venous flow velocity, ankle swelling, leg heaviness, and walking tolerance before circulation-related pain
begins.
This is what Dr. Whitfield told George to do, and it changed George's legs in 3 months. It is free. It requires no equipment. It can be done anywhere. And the only thing it requires from you is consistency and the understanding of why your legs need you to do it every single day. I am Dr. Daniel Chen. If this video gives you something that changes what you do every morning before you get out of bed, please share it with someone over 60 whose legs ache or swell or cramp or feel heavy by the end of the day. It might be exactly what they need to hear. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real information about their own health. And leave me a comment below. Tell me how your legs feel by the end of the day and whether anyone has ever mentioned ankle pumps to you. I read every single comment and I genuinely look forward to hearing from you. Take care of your legs. They carry you through every single day. They deserve to be taken care of in return.